Welcome to our viewers at home. I am Simpiwe Silwana, your host for the ANC Connect Podcast, where we want to bring leaders of the ANC, leaders of government, and leaders of society to come to our podcast and have a conversation with us about issues that are very, very much important to our people. Today, we have the MEC of Health in Gauteng, Cde Nomantu Nkomo-Ralehoko. Molo mama.
Molo Putis.
Unjani?
Ndiyaphila unjani?
Thank you very much for joining us today here on ANC Connect, which is a platform where we want to have a conversation with our leaders, especially regarding a lot of the work that they do. Because we find that many people in our communities just see that there's Minister X, Minister Y, MEC X, Minister and stuff, but they don't know the work that we do. But ndiyava umama Orlando Pirates.
Orlando Pirates fan enkulu.
Ungathi soma nengxaki
Ndibe nawe nevuvuzela esaqaba. Ngendingezanga ke mosiku. Bakanti ngophalobhakania ngendingasondelanga khona.
Thank you very much. Delikhosi. Thank you very much, Mama, for joining us today. Umama, as much as you're an Orlando Pirates fan, you are also an ANC activist.
Yes.
And you've been an ANC activist for a very long time.
Yes.
I think you joined the legislature in 1999, yes. Gauteng.
Yes.
And you've also led in so many structures. Mm-hmm. And I know that you started in COSATU, you were in the Harbour and Railway
Workers Union.
Mm-hmm. So, kudala ukhona Glendo. But would like to know, Umama, tell us more about Mama Nomantu before the MEC, the leadership roles, how you joined the ANC as a young black woman.
A rural girl that was born in a town called Engobo in Eastern Cape with one street called Engobo Highway. I'm proud of that place because this is who I am, coming from that area. And I moved to Gauteng because my father was working in Vereeniging at Rand Water Board. I came this side when I was 13 years old, coming for holidays. Then since then, it was my home now, second home, Vereeniging in particular, to be specific, and I end up working this side. And I've been working, I studied, part of my studies, especially the tertiary level, I did it this side because I only did matric at Eastern Cape, from primary to matric, which was at Nyanga High School, not from the town of Engobo. And I was at a boarding school there, but immediately after that, always during holidays, I would come to Gauteng, to my father who was working then in Vereeniging. Then I learned about the trade union because of my family members that were working at COSATU, were members of COSATU. My brother was a member of NUMSA, and my cousin sister was working for Construction and Allied Workers Union. So after school, I would go to them because I was working I was at Val Secretariat, that was in town. It was one of the branches of the Val University, now as you call it. So our branch for administration was there. So after work, I would go and practice the administrative part, so every homework or the projects that were being given, so I would do them there. Then I developed an interest because now that's when I knew this thing called African National Congress at that time. And when you talk about the ANC then, you will not even scream about that word. You'll have to talk it quietly because you don't know who's hearing next to you, who will make sure that we are banjwa. Because I remember at some stage when I was working for Saru, we were just here at 30 Baker Street, down there next to, not far from John Foster. Then now it's called Johannesburg Prison. It was John Foster Angit. It's Namanda Batal. So at that time, and there were some posters, and these little ones, the posters and the stickers, so that were packed in a box that were coming from outside. So they were in our union because Martin Sibekwana was our SG. They had that box. So I was told to hide the box. And I was so scared of hiding that box because I didn't want to go to jail. So I was telling them that, and I was crying at that time, I don't want to hide anything that is related to the ANC because I'm free at jail. So everybody was laughing at me because there was nobody who said I'm going to go to jail. But I managed to hide them, by the way, because they told me that you are going to keep this box. When we need it, we must find it. And it was an exciting thing now when I realized that I was still young, I didn't understand, but I developed the interest then. And then I never turned back. because I felt that I need to be part of this organization, which people were telling us. But one thing that was interesting when I was working with Sister Dorothy Mutubati, she stays at Tlati, she's still around, and other people like you. Hope Papo, by the way, we met there because Hope was doing the constitution of helping the comrades from Pope Crew, Pope Crew comrades, He was helping those comrades to write the constitution. There were 3, those comrades that came with Hope in my office. So I was typing the document that I was doing. So I developed an interest, and I was working with Ubaba Usten Nkosi, and I was working with Tato Khalima. We used to come, I visited Babu Usten Nkosi. Bafana Stole was in the office, Martin Sbakwana, Potchiter, all those leaders that were the leaders of Saru. So they used to study, then they used to share books. And when they bring the books would be in the scafftin as if it's bread or food. But inside there, or this ice cream packet, so those books would be there, your APCs that were coming from Moscow at that time in Russia. So when I went to school, because I end up at Moscow at some stage, so when I went to school, when I saw those books and I read them, I still have them, by the way, all my APCs and my Das Capital. I was so excited. It was an excitement for me that I've known these books even before I can come to this country where these books are, because I end up going to a trade union school through Martin Sbakwana that was instructed by the leaders. Bab Shope was one of those leaders. Nobabu Eric Mjali that said, I must go to school when they see myself with the 30 administrators that were sent to Zimbabwe, because they were preparing us for the unbanning. So we went to Zimbabwe. Then there was a course that we did there for a month. And in that course, the interesting one is that when I arrived at the airport, I didn't have a visa. And we were supposed to get our visa so that we can go out. So I was the only one after the 30 who didn't have a visa. I was the youngest again, but the surname was Nkomo. So I don't know why they kept it, but I think it was kept at the offices that side, trying to investigate who is this Nkomo that is coming with the delegation. So I slept at the airport, and the following day the ambassador came. It was Babu Mlonyen, I think. They came in the morning to come and release me that I can go, but already they were preparing to take me back to South Africa, the security at the airport. But they came and clarify who I am, where do I come from. I was having my incwadana yokundwendwela, by the way, which is my passport. I've kept it so delicately at home. In fact, it's in the safe as we speak, because I don't want to lose incwadana yokundwendwela. Because from that time that I was in Zimbabwe, the incwadana yokundwendwela take me to Moscow. And again, people that it was Daki Africa, Hope Papo, and Bafana Story that made me to get incwadana yokundwendwela in Chimiston, because I had to go to Chimiston to get that document. So for me, I treasure that document because it took me from here to Moscow, and then I came back because I stayed there 2 years in Moscow doing my study on trade union movement. And part of those, it was the interest that I developed in economics. I studied there in Moscow, the economics, so it was part of my subjects in international relations.
So I see that your grounding is very much in trade unionism and workers' rights.
Yes.
But I saw also, as we're doing some research and we're looking at Umama, that Umama also was working for, I think, Balega at some point in the ANC Women's League. So there's a bit of grounding of the Women's League also there, which leads me to a particular question that is of interest, especially in our country. And that is women in leadership. And you have been in leadership positions. As I said earlier on, you were in the legislature since 1999. You've been an MEC of Agriculture and Rural Development, e-government, finance, education. And
For one day in education. One day in education.
For one day.
I brought the report, and in agriculture it was 25 days. At least I did some work.
You did some work.
But again, the advantage in agriculture was the chairperson of agriculture at some stage at the legislature. And so at least that's why I had an understanding. And I developed an interest then in agriculture at that time, which I think is still the subject that I love so much, because in the legislature I've been part of ETC cluster. Okay. I've never been in the STC cluster. It's the first time that I'm on the social cluster, like I'm in the health. In fact, I never even had an interest, to be honest with you, on the STC subjects. But now I can see the importance of social transformation,
Yes.
because it's key. It's still linked to economics, by the way. But at that level of economics, it was like this thing when you're at high school, they will say 10A or 8A or 10B. Those are the best classes. So I used to have that a little bit. These ones, they are the
competition.
Yeah, they talk about poverty. Forgetting that poverty, it's critical, because you can't just talk about economics and leave poverty. Yeah, social aspect. So for me now, I'm interested on this side, and I've learned a lot here in the social cluster, which is key. Now it's close to my heart now. Yeah.
Which is where I was going with the question with regards to you have this experience, and the ANC has given you these responsibilities, especially at a young age, 1999, and giving and having grown in Gauteng and in the leadership of Gauteng as a woman, and you've been in the women's league, you have grounding there. Tell us about that experience, an ANC Black woman leader.
I had an interest indeed on leadership, especially to lead as a woman, because my interest was that I was going to make a difference. And I always wanted that, because I've worked with senior women indeed that are leading. Sis Baleka was one of those. Siviwe, or Sis Mam Nkosazana, then Sababizo Sisi at that time, Mama. But interestingly, I looked upon them. I wanted to be like them. And I felt that it's possible when I look at them that they are able to juggle between the family and the organization. But they were making a huge difference, especially during the time of Codesa. You'll see Sis Balega sitting with those men at the Codesa and discussing issues that are affecting women. And my interest has been always that I want to speak for those women who can read and write, because my mother can't read and write. So I always associate myself to be the person that has been taken to school, so that I am able to translate what I've learned to those women. But again, as a woman in leadership positions, you always know that there is so much a responsibility that it's on your shoulders. You must make sure that when you are in those positions, you make a huge difference. People must see you doing some work, and sometimes you must work even harder, more than even your male counterparts, because you don't want to lower the level of women. You always want women to be at that level. I remember, because I've been trained on political education, I was one of the trainers. Part of the things that I wanted to do to challenge was for me to always present on strategies and tactics and an organizational renewal, because even now I still feel that when you do that, you are making a huge difference, because you are talking about the basics of yourself leading as a woman, but leading in the ANC, but changing the narrative that women can lead. And I think we've made that mark, some of us as those women, because we're not many at some stage when we started. By the way, I nearly became a journalist, because I remember part of the things that I used to do is to write for Learn and Teach. I had some articles on young women, how to the empowerment of young women. Those are the things that we used to write, and I would write those papers. And I end up even writing those papers to New Nation. There was an article that I wrote there. When we were preparing for the conferences, I used to write. And I didn't talk much, but it was easy for me to write. And I knew that this is the area that I want to do. And when I was in Moscow, even at trade union school, I wanted to remain, but because it was cold, I said, no, let me go home. I can't stay in this country. 2 years, it's enough for me, because I was going to study for 4 years doing journalism. Then I had to come back home, because that was another area that I wanted to do, feeling that this is what will help me to translate what I'm talking about now, of making a difference to the people through pen and paper, but through interviews that I will be doing to the communities, as doing research, the research work. I used to enjoy to do the research. Even now, there's not a single paper that I don't pass when I'm at school about research, because I love it and I know it and I understand it better, because it takes me down to what people should be and what changes you want to do if you're a woman in leadership.
I think that's very important in what you've articulated right now, of the importance of showing up, because you saw other women before you showing up, and making sure that when they are in those spaces of influence and power, they know that they are not just carrying themselves, they are carrying all of the women of South Africa. And it must have been a privilege, as you said, you were with Abo Sis Balega, Sis Nkosazana, well, Ngomama kum, actually Ngomakhulu kum. And that has shaped your leadership. The fact that you understand that you're not just carrying your responsibility of just yourself as Osis Nomantu, but you're carrying on your shoulders other women as well. And the ANC gave you a responsibility, and that was to be a deputy chairperson in Gauteng. And during that time,
I was a deputy secretary before.
You were a deputy secretary. Anyway, sneaky credentials. I'm cutting your credentials.
Don't cut them. I used to enjoy to be deputy secretary.
Deputy secretary. So you've been a deputy secretary?
I hated to be a deputy chair, to be honest, because for me it's like you have to wait. You don't do the job. You must wait for somebody not to be around, or he gets tired in chairing, and then that's the only time you take over. To be a deputy secretary for me, I'm more hands-on. So I like it. That's why I'm happy even to be the deputy coordinator.
Yes.
Because I know that I always have responsibility.
Yes.
Can't wait for Hope to be sick. There's always something that is cut for me, even in the constitution.
Yeah. So that's the conversation where I want us to go to now. In terms of during that time, we went through elections in last year in 2024, and we saw for the first time, in my recollection, the ANC not getting the majority in Gauteng. What the SG of the ANC has called a strategic setback. And now there's a government of provincial unity, meaning that the ANC is now not governing alone. So I want us to go there now on that conversation and how that government, which is different from what our people are used to, how is it impacting our people? How is it working? Tell us more about the ANC in Gauteng now in a coalition setup like never before.
In the province, we have the government of provincial, what do you call it?
Government of provincial
unit, yeah. The GPU. Yes. And the Women's League said I must write a paper, the NEC of the Women's League, because I'm in the NEC of the Women's League on that specific area of government, the ANC that is in the coalition now. That's when I was writing that paper, I realized that indeed this is a strategic setback for us, because we have lost all the things that we used to do, all the opportunities that as government we used to have. Now even today we had the motion of no confidence, vote of no confidence to the Premier. It was one of the difficult things that we had to go through, because now you have to convince everybody. Why do you think that they must vote with yourselves? Before, we used to convince them just to vote for us for the budget. As an MEC for finance, I'll even phone some of the comrades, of the colleagues, not even comrades, just to convince them that, please, this budget is important, we must vote for it. But now on this one, it's very difficult for us as the organization to lose elections. It's a painful thing, because you lose some of the opportunities that we have. We've lost a number of MECs. We used to have 10 MECs. Now we have less than that. We have 7 MECs. We're lucky we're supposed to have 6, but we had to negotiate at least to have 7, because that's why we end up fighting with the DA, because they wanted to have 4. And 5 must be them that decides which party they must bring in. So it was going to be 5-5. Definitely, we're not going to take any decisions on that. So it's very painful. It's a difficult exercise that we're going through now. As much as it's true what SG is saying, that it's a strategic setback because we have lost. But now we're not going to surrender everything. So we had to do the give and take and then be able now to lead, because at least we are leading their government departments that were running because of those negotiations that had to take place.
So this give and take is interesting in the sense that when we were governing alone, we understood what needed to be done in terms of servicing our people.
Oh, yeah.
Using ANC policies. And now you are in a GPU, meaning you have to convince other people and other organizations which have different ways of thinking than yourselves in the ANC. How has this GPU impacted service delivery at a ground level, because our people, they don't care about those negotiations. All that they want is service delivery. So how has it impacted it positively? How has the ANC maneuvered its way so that our people do not suffer because now there's been a change or a coalition in place?
I think because we have the colleagues that are coming from the other parties, we've been working with the IFP very closely even before the GPU. So it's not that much of a problem on our side. Same as POSA, including the PA. So those are the three colleagues that have joined us on our side. So at least I can say that we're working very well with them. There's not much of a difference, but in the municipalities, that's where you can see the problem. Sometimes when the other parties have taken over in that specific area. So in the province, it's better. In the municipalities, that's where there is a problem. Then we need now to coach and work very closely with our colleagues at the municipal level, and even as a province, bring resources from the provincial government to the community so that we close the gap that is there. But at the national, it's worse. You have seen that it becomes difficult even to approve a budget. The negotiations that took place for them until they reached the consensus to lead, it was very difficult. It's difficult even to adopt the budget because of the juggling around it that they are doing. So it's worse at the national level. In the province and Gauteng, I think we've managed it so well that even during this motion, it was easier for us to meet with them and convince them that this is the situation and they understand. So, but it's not something that I would say we must continue with it. We need to work very hard, improve the services to the citizens so that people can believe in the ANC once again. It's a convincing now that we must do that. The ANC is still the organization that is there for them, that is alive. That's why I'm sure you have realized at least we have been winning some of the by-elections that we have been having in the province because of the work that we all do now, because we can see that we don't want to lose further than that we've lost, and we're under 40% in the province and at national. So, but it's a painful thing, I'm telling you, because once you go to the communities, you realize that there are those specific areas that we have not reached out that need us as government to work. But the strategy of bringing the provincial resources to the local municipalities, working again as the provincial government, it's helping us very well. And we're trying now to bring even the municipal. It's worse on our side where you have almost all your MMCs in the municipalities for social health and social development. They are all coming from the other organizations, and 99% of those are those red overalls. So it's worse when you have that, but now I have to have a way of working with them in the municipalities, which I think it's better. But sometimes you can see that these ones, they are going to hit us if we bring them in some of the programs. You have to be very careful now when you do work. Even in the meetings, you have to be very careful what you are presenting to them. Is it going to help the ANC or is it going to destroy the ANC? So it makes us now to think differently.
So that strategy,
that's strategic setback. That's there because you have to think differently. You have to do things differently. You know that these are not my people that I'm sitting with them. These people are going to take our ideas and implement them. So you are beefing them up. You can see even now when those who are having offices, they want to employ people, and you can't tell them no, don't, because they have the offices. They are complaining that you are closing us out, and we want our own HODs, our own municipal managers, if it's municipal managers. So it's a really painful exercise that the ANC is going through. I don't want it to go through it again.
So, Mama, it's actually quite interesting the moment that we are in, and as you are unpacking these challenges in terms of the strategic setback that we have encountered. But one thing that I have noticed and we have seen is that services are still being rendered to our people. Because one thing when we go to our people is that they don't care ukuba the other parties are there. They still want leadership from the ANC. And in your particular portfolio, especially now that you've been deployed MEC of Health, we are seeing that work being done. And you have gone on a major infrastructure development program across the province, where we see in Bethel you have 60 beds for a new mental ward. We see refurbishments at Chris Hani Baragwanath Hospital. I think we have over 27 projects just in this financial year in when it comes to your portfolio. So there is work still continuing that our people are expecting services from. So tell us more about the work that is being done in your particular portfolio.
We're doing quite a lot of work in our department, and it excites me when I think about it, including the achievements that we have done. Part of those, indeed, is the infrastructure upgrades that we have done. We are refurbishing quite a number of hospitals. We have wards. Even at Begimlangen, there's a new ward that we've built for mental health. And at Kopanong, we have a new ward that we've built. But again, there's a gateway clinic that we've built at Kopanong. That clinic, it's here to help us because it's more of a station where you'll find everything there that is being done related to mental health issues. Then at Sebokeng is the same. We're renovating accident and emergency area in Sebokeng. But there's facelifting that we're doing almost in every hospital in the province. And you remember, I always say we're not even maintaining, we're refurbishing. Because we move what is old there and put something that is new, that is better and that is new. And the facelifting that we're doing is that almost everything that is at the accident and emergency area, you must find it lookable. Sometimes you can go abroad to some of these hospitals. They will never show you at the back. They will show you where they are, accident and emergency area, where people see. And then you can see that, wow, this hospital is beautiful. But if you go at the back, you realize that they still have old beds, old machines, but there are new ones that are there. And taking you to the issue of the machines, part of those upgrades that we've done is to make sure that our health technology is new. We're buying your CT scanners that are new, that are beautiful, and we're installing them as we speak. At Dr. George Mukari and Chris Parakwanat, we're building bunkers there with those big machines that are going to just get inside there, and then we scan you. We find if you have a problem or not. It's one of the things that we always say, that think that oncology services, we don't care about them in the province. They must go and see those machines that we're buying at Steve Biko, at Charlotte Makleke, and now we're buying x-rays for community health centers, which is our clinics that runs 24 hours, so that you don't go to a hospital just for an x-ray that you want to do. And we want to make sure that all those clinics, bigger clinics, which are 24 hours, they have those machines. And we are making sure then again that there are doctors in our clinics, so that there are things that you can't go to the hospital to be checked. But if you get next door in a clinic, you can be checked by a doctor and some nurses that are there. But on infrastructure, we are moving very fast because we don't have time, and we'll find a lot of old hospitals, like our Tambo Hospital was I think it's 1902, yeah. It's an old hospital. You can see even how it's designed. There's an old part and there's a better part. It's not even new, even that one, but we want to upgrade almost all the wards in that hospital, including other hospitals. As I've said, in Sebokeng, in Kopanong, in Heidelberg, we have a beautiful mother and child ward there. It's a maternity ward that we've built with latest beds. When your wife go and deliver in Heidelberg, you are sitting there as a father. There are even those rooms that you'll find at private. And we want to change even the beds. They always laugh at me, my team, when I go to hospital, because there are these beds that you press, they just turn the patient themselves. It's no longer now the nurse that must be turning the patient.
Yes.
So I always say, this is what I want in all the hospitals. And we're buying them already, almost half of the hospitals. We have this beautiful hospital that we don't talk about it, Bethakoa Hospital, with this new old hospital now that we're turning into a mental health 60-bedded, as you have seen it, 60-bedded unit that is there, and people are there sleeping there comfortable, whether they are sick or not, but they are sleeping there comfortable. Same as Chris Parakwanat. I call it a construction site because you find contractors on site there. I think we have about more than 6 contractors that are on site now. So that's why you no longer hear us saying we don't have linen because the boiler is not working, because people are stationed there, they are working there. So there's a huge improvement that we're doing in the province of changing the face of our institutions, especially our clinics and our hospitals. But again, under this health technology is to digitize our systems. Remember, I wish you can go and see our cameras at Para, that we are going to link all the hospitals in one room. They are operating just to see para now. But those cameras, we're going to link them in this financial year. But again, we have e-filing. Remember, people have been complaining that I go to the hospital, I'm sitting here for more than 4 hours. I don't see my file. Now you can see your file because we have e-filing that we are doing in our hospitals.
Which
all of them
up the waiting time.
Exactly, speeds up the waiting time. But again, the cases of litigation, most of them we're losing them because we don't have information. So that's why I always say, let's not undermine information. It's key because you lose a case because there's one piece of paper that is not there in that file that that is lost or it's stolen, whatever it is. But those are the things that we're trying to keep. Queue management, this issue that you are raising now, we've started with queue management at Charlotte Maxeke, Raima Musa Oti Hospital. We're rolling it out now to all other hospitals because those are the major things that people don't want. You don't want to go to a hospital, your child is sick. Once you are a parent, if your child is sick, you become sick even yourself as a parent. We start counseling you because you scream more than the child that is sick. So we try and make you understand. But we can't do that. We need to make sure that the queues move. Or as much as we're servicing a lot of people, people don't understand. In all these hospitals, we have 37 hospitals in the province and more than 300, almost 400 clinics that we have. But we're servicing not only citizens of Gauteng. People are coming from other provinces, but besides, people are coming from the neighboring countries, and we can't chase them away. As you have seen Operation Tutla was saying, let's chase them away. There was a child from Malawi that was denied access by Operation Tutula, and the child died. And I had to be the one that answers why the child was denied access at the institution. So that's why we had to open up some cases for those that are closing people not to get in, because health is a human right issue. You can't stop me from getting services in any country, anywhere. And there's this notion that people think that these people get there and not pay. They are paying, whether it's 20 rand a file, because we have 100 rand registration. Everyone that gets into the hospital pays. So then you can be serviced then. But people say people are not paying. I don't know where they take it from. I've never seen that in front of, because now I go there to my hospital, public hospitals, I pay. In some hospitals now, we're installing the app for medical aid. I pay with my medical aid. You go to Steve Biko, you go to Para. In all the academic hospitals now, we've installed that app, including other hospitals who are rolling it out. We do pay, whether you pay cash or you pay with your medical aid, but there are systems that you must pay. And we want to move to cashless at some stage, but we're starting paying with medical aid in some institutions. And we want to encourage yourselves, go to our public hospitals. I always say, you are not going to get a 5-star treatment, there's one there. But you are going to be cured. You are going to live there fine. I'm not going to give you custard and jelly, but you are not going to die. But some of your colleagues then, especially you young ones, once the medical aid is exhausted, you come to me, I take you to Charlotte, and then you're fine, I take you to Steve Biko. But again, what we're going to do, which we're going to invite this organization with my team, is we're going to have a health symposium that we're going to showcase all the things that we've done in the province. That will even talk to these things, because there will be some videos that are rolling out showing you our hospitals, showing you the equipment that we have, showing you the professors that we have. I want people to stop going to Turkey, because they go to Turkey, come back sick there, and then our professors again are fixing them. I want the Turkey, because we can do what Turkey is doing. Even today, the chief whip at the legislature was shocked when I was showing him the treatment time guarantee that we've introduced now in our system that talks to you if you are going there for knee replacement or hip replacement, the time that will take to do that procedure to you, how much time that we need to do, but how we keep you in the system so that we don't lose you, because we're digitizing now our systems. Because Department of Health, I'm sure your colleagues who have been with us at some stage, you know them, they can tell you that we're way backward when it comes to digitizing the systems, but now we've changed. We're digitizing our systems, which is an achievement for me, especially to you young people.
It's interesting that you would bring up the private vis-a-vis the public health system in South Africa, and our people rely a lot on the public, which then sparks something in me, and because when it comes to the ANC, there are so many initiatives that our leaders, such as yourselves, do, but there's an information gap where people don't actually understand certain initiatives that the ANC brings about. And as you're speaking about some of us who go to private and don't go to public hospitals, it then sparks the fact that National and yourselves are introducing what we call the National Health Insurance. And many of our people don't know what does it entail at a simplified form. I saw some poster a couple of weeks ago, and it was one of our leaders at an institution of higher learning. And I was like, I wish, and maybe it has happened, and I just haven't seen it, where we take this information to our communities. So as we're saying here, we are ANC Connect. So we want our people to be connected to this kind of information too. So at a more simplified form, what is the National Health Insurance? And how is it going to benefit our people?
It's a system that is going to help us to be able to give services to our people closer to their areas, but to their doorstep, but again, without any amount of money that they must pay. Because we're going to have some doctors, because we've already collected the database of the doctors in the province. We know what the GP doctors that will be working with us at the public hospitals. Those are the private doctors, but now we're linking them with our system. But we'll be able to assist anyone that comes. And then there will be, because it's a fund, remember that we're talking about, then those people will be able to get the money back from government then. So there will be that board that is going to manage those funds that will be assisting our people. So that even if you don't have money, even if you are poor, but you'll get the best service that you are supposed to get in an institution. So we are going to work very closely with yourselves as ANC Connect so that you take this message to the people. We have been doing some workshops in the province, taking some rounds, telling them about the National Health Insurance. What is this fund going to do to them, which is going to assist them to ease up the pressure that they are having. You are not going to leave a hospital that is next to you now and go far away because you don't have money. It will be easier for you to get there. You will be registered and then you'll be in the system. That's why this issue of digitizing our systems is going to help us, because once you are there will be one integration of the system in terms of people that are patients that are being serviced and that are being cured. So once you're in the system, we will know you, that you are there, and it will be easier to be treated. And then after that, there will be some claim that the doctor will do to the fund so that you have been helped and you have been assisted and get some medication and go home after that.
That is the most simplified version of the National Health Insurance I have also ever heard. And I'm very much thankful for that, because these are things that our people must know, and that they must know that these things are for our benefit as the community. And the ANC, we need to bring the information closer to the people, so that, as you said, that you don't leave a hospital right next door and you travel far, Gandhi, you can be able to go to this hospital. And we have great plans and we have great initiatives, and we are executing those initiatives, and your department is executing those initiatives. But I want to come to something that's sort of a hot button issue, and we've seen the protests taking place, and where graduates, nurses and newly graduated doctors are saying that they are not being employed. How has the Gauteng Department of Health dealt with this issue of unemployed health graduates?
We've been managing it so well, because I've never had doctors coming to my office to sleep in my office, for starters. Didn't happen in our province. You've seen it in other provinces. I will not name them. But here in the province, we made it a point that immediately after COVID-19, all the doctors that were working with us on contracts, we bring them back. Some they are consultants, some they are permanent now, some they are still doing sessional work, as they call it. So that because it's not that we don't have space, but somebody will decide that now I want to do consulting, I want to be sessional, I want to be permanent. So, but we've employed a lot of them. Then when it comes to our bursary holders, we've employed all bursary holders. Because remember, they went to school, we're using our money as a department to take them to school, then we absorb them in the system. So we don't have doctors that are stranded in the province. We've employed them. Even now, there are opportunities. After the moratorium, we close for a year. We're not employing anybody because it was a national issue, that issue of the moratorium. When we opened again, we started with the doctors, started with the nurses, but we are still very low at the level of the nurses. But what we are doing now, because some nurses are resigning, some are there, some are at home. But again, there was a call that we did even on the nurses that everybody that was working with us during COVID-19, they must come back. Then we absorbed those people, all of them. But there are those that says I was left out. I don't know what was the problem, because we find there was a group, about 19 of them from the area of Tembisa, that said they have not been employed. They have not been employed. They are raising their reasons. But the Department of Health, then the team at HR, they are busy trying to find out what is the problem. Are they legit people, by the way? Because we need to check again. If they are 19, where were they when we made a call? Because we said, bring your pay slip, go to the hospital where you are working, so that we can check if it's real, it's true, it's you. But again, we've opened up posts again now, so that people can apply. Especially, we're prioritizing those again that were working with us. So that process is still running as we speak, because others, we have taken them as contract workers. I know at Para, I even addressed them because I met them 2 months back. They are on contract, but they wanted to know, are we still going to be on contract? What's next? Then we agreed that we are going to open up opportunities, but you will be the first ones that will take in the system. So we are employing people, especially doctors and nurses. Then the second phase will be employing porters, administrators, which is coming even that phase. But again, we've prioritized the CEOs, chief directors, because in some hospitals didn't have CEOs. They were acting the ones that we have. So we're in the process now of doing some interviews for those CEOs. So we definitely were employing, and doctors, we've reached everyone that is supposed to be employed, and the opportunities are still there for them to apply.
Okay.
And we're prioritizing Gauteng.
Oh, that's great, and I think they've heard it here on ANC Connect that there are new posts coming up, so they must apply. Your background, as we spoke, is at economics, with economics, and you have brought in the department serious and stringent financial controls, and we have seen certain things happening that have been in the news, and here, as in the ANC, we are never shy to talk about certain things. And at the top of the mind is Tembisa Hospital. So, as the department, how and what measures, and I know there are some measures that you have put in place to control financial controls, so that what happened in Tembisa doesn't ever happen again. Can you tell us more about that?
We've put up systems in almost every institution now, including our central office. We're making sure that now we tighten those controls. There's a procedure that you follow, even if you want to do anything. We didn't have money, indeed, in the department at some stage. I remember, because I was in Gauteng, and I was at the legislature, I knew that the Department of Health in the second quarter, they no longer have money to buy bread or buy anything. But now at least we do have that, because of those tight controls that we've put in place. And we don't want what has happened in Tembisa to happen again. We're not proud of that, because it has really reversed our gains. In fact, it rubbishes all the good work that we've been doing in the department in terms of putting up systems, making sure that we follow proper processes as a department when we are doing things. But one other thing that the department was not doing is to pay suppliers. That's why we had a lot of accruals. We're coming from 8 billion accruals, and we've taken them down now. We're sitting at 4 billion. Now it's 2 billion, I think. We're 2 billion now, because we've been gradually cutting them, because it has been a bad thing that you can't get a clean audit because you have these accruals. We have irregular expenditure that we had a huge number that was coming from irregular expenditure in the department. And even that one, it's going down now. There's a huge decline on irregular expenditure. And again, as we're unable to pay suppliers, now we're able to pay at least 80%. We're sitting at 83%. We're hovering there, 86, 85% in terms every month of payment of our suppliers. Some, those little monies like 10 Rand, 20 Rand, we pay them within 15 days. So I think there is a huge improvement and achievement because now we have money. Before Treasury, because I was an MEC for finance at some stage, you will just look at them. They were borrowing money from the money that comes in April. Already you must start giving them something so that they're able to go and work. Now we no longer have that program. And I'm proud that this is one achievement that as a department we have made it. We're paying municipalities, municipal services, where nobody can go to a clinic now and cut because we're paying those services. And we're making sure that people submit their invoices, because the other thing was that because we have a lot of institutions, they don't submit the invoices. But now at the central office, we send people directly to those institutions, attach them that every day you must make sure that you communicate with these institutions and bring back the invoices so that they're able to be paid. But again, tightening of controls, it's key. If you are having money, you can't have everybody putting his or her hand in the jug. So we're making sure that in that jug, that stricter measures, who must release the RSLO as they will be saying, or whether it's the RFQs or whatever. So we have stricter measures on that and the verifications that must be done. Because even part of the suppliers, as we're paying accruals now, we have a strategy of saying, let's pay 30% accruals and 80%, 20%, it's 80-20, yeah. We must pay 80% for the services that we've received, but 20% for accruals. So even there, we're verifying and investigating some of the accruals that we have before we can pay you. It's a slow process, and we do negotiations to some of those big contracts that we are unable to pay 20 years back, by the way. I'm not talking about accruals that it's yesterday. It's years back. So that's why you have to verify, find out if indeed there was work that was done, because you can't just open floodgates and say everybody must come. So those are the tighter controls that are doing. And every week we check, you come and present the overall finances, and the CFO, when they present, you will see where they were becoming red, were overheating. We call it a language where finance. When that one is overheating, that program, we say cut it down, stand. You must be in one place, and then when we move together. So it makes our life easier because we can buy medication, we can buy everything that we need, food for our patients. All those things we're doing ourselves because of those stricter controls and stricter measures. But remember, it's not easy to do that because people don't want change. If you bring those things, it's going to be very difficult. But I mean,
pushback.
Yeah, there will be a pushback. But I think now people understand that it's not that we're funny. It's because we wanted to make sure that things run smooth. The department is not the department that is being known for not paying services that they receive, because it's crime for me that I'll receive services and I'm not paying them. Yeah,
I think that's really important. And these are things that are not populist slogans. This is the hard work of controls to make sure that money which our people pay taxes actually go and service them properly. And a lot of people don't understand these things. We just see the headlines, the propaganda.
In fact, if you can go to Tembisa, even Tembisa have improved drastically. We have a new CEO there who's acting now. She has been a CEO in another hospital, and we put her there, Dr. Low. She has just improved Tembisa. But unfortunately, she's in Tembisa, a hospital that people don't see that it's good. But even the patients that are there, if you go to them, they will tell you a huge difference that has happened in Tembisa.
And we're glad that there's Tembisa is no longer going to be the negative story, and there's a turnaround in that, which is now leads me to almost our final point of our discussion, which is we give these services, and the ANC in how it operates is that the people must benefit from these things. Everything that the ANC does is directed to the services of the people. But there's, as I said earlier on, some of our people don't know these things, which lead us to electoral setbacks. And I'm going back now to your ANC politics. You are in the ANC PTT of Gauteng. You are the deputy provincial coordinator. So back to elections and having your hand in being busy when it comes to elections. The ANC is going to a very tough local government elections, where we have, since 2016, we have seen a setback electorally when it comes to elections. What is the plan, or how is the Gauteng PTT going to deal with the issue of tackling elections at a local government level next year?
We are working very hard to make sure that now we clean the ANC so that people can see the ANC, the same ANC that they used to love, that they used to enjoy the services from it, that used to speak for them. And what we've done is to make sure that we deploy some comrades to various regions, and we're working very closely with the regional secretaries in those regions. We have a clear program on the elections. Already the elections team is sitting every week, making sure that they prepare for the elections, but they prepare for by-elections, because we've been having by-elections. Even now we'll be having by-elections in West Rand, in Ekurhuleni, and we're working very hard towards those. Because for us, once we win by-elections, it becomes an achievement. But again, we don't want to win by-elections now with a low number of people that have voted for us. We want to always have at least a bigger number that will show that we are there and we are visible. But part of our program is to work very closely with the deployees in government so that they can bring the services to the communities. And we've been doing that quite well as the organization, of making sure that we translate those programs of government to the communities using the ANC banner, and working very closely again with the ANC caucuses in the municipalities and at the provincial level. But deployees must always be visible in those communities. That's our key thing that we've been raising to them, even when we have our meetings with them. That assessment we're doing. And I believe that the ANC can get back where it used to be. If all of us as leaders of the ANC, but as members of the ANC again, we behave in a specific way now, the way that people will take us serious. Because at some stage we neglected people. We're taking people for granted. I think that's another thing that has made us to lose, of thinking that anyway bazasivotela. Besiyithanda loo nto leyo, and ayisincedi nganto lokuthi bazasivotela. People will not vote for you if they are sitting there. They don't understand what government is doing. They are sitting with their children that are not going to school. They are sitting with their children that are not having unemployed, because that's another thing that we've not been doing, of picking up in those small issues. We have some specific programs in our government departments, like your community health workers, your EPWPs. We need to assist communities with those programs, not only be inward looking. Let's take those to the communities. Even if you get 2 or 3 people when there is a program, that will bring them on board from the communities. People understand and they know that umntakabani uyasebenza ngoku ngenxa kabani usebenza ezi-ofisini zikabani, uyayazi moslonto leyo. It makes parents feel good. Nobody will leave the ANC if bayatya batsho njalo estand ke kuthiwe siyatya ngenxa yale ANC lena, ngoba that child brings food on the table. And we need to encourage our colleagues, but we need to strengthen even small programs that we always undermine, like agriculture programs, household food gardens. We've introduced a program in government, in my department, 1 clinic, 1 garden, 1 clinic, 1 1 garden, 1 hospital, 1 garden, 1 clinic. It helps because even the board members, the clinic committees are part of that program. And they have beautiful gardens now that they've done. We even in the hospital use their own spinach and not buy, because they are selling to the hospital, or they are buying, the hospital buys from them and even sell to the community around the area of what they've used. Those are the programs that we must bring back, so that nobody lives or sleep without food on the table. Because how painful it is when you have an event, people go home and then people don't have anything. How painful it is when you go to the clinic, then they tell you that your child is malnutritioned, but you don't have food to give this child. But if they give you spinach or cabbage or beetroot and say, go and cook for your family so that when a child is malnutrition, these are the things that they must eat. These things are in their garden themselves. It's so beautiful to see those things. So those are the small programs that we undermine. People don't need tenders. I always say that not everybody is a tenderpreneur. But they need something from government. They need to be assisted with legal help that you give them. You are making a huge difference to those citizens. So I think once we go back to basics, do those small things that can cover them, that makes them feel good. Sometimes they feel good just for you as a public representative. You attend their funeral. That's why I believe when SG says hambani mingcwabo ningcwabe nosana noba nilazi, is the truth that you must do. Because once you go to a funeral or uyotsidisa uphethe bucket lamakhekhe, the family gets so excited just to see you. They don't need money from you, but just your presence to be amongst them. So we must be seen amongst the people as the organization.
Yes.
That's the biggest mistake that we did. When we went to government, we forget that the people that put us in that government are the people that must see us amongst them. Even our old friends. When I arrive at home in Eastern Cape, I go and see and they feel good to sit with me. Just talk nothing, reminding ourselves good. After school, it makes them feel good.
So an ANC that connects,
Yes.
an ANC that integrates itself with the people, an ANC that is not separated.
And we must humble ourselves. As leaders, we must humble ourselves. Humility, it's one of those things that it has just moved away from us. With these positions that they've taken some of the basic things that we used to have. Just greeting abantu mawudlula endleleni. Wambubulisa nje akhona abayicelayo kuwe. Bafuna nje umholo wakho mawudlula. They feel so good about that.
Ndiyakuva mama, and thank you so much for that. So final question, we are winning Gauteng, our metros and our municipalities.
We're going to win.
All of them.
We're going to win all of them.
Yes.
Trust me, I'll be there.
Yes.
I'll be leading the charge.
Thank you very much, Heike. We are very confident. And thank you very much for joining us today on ANC Connect. I think it's a conversation that was needed. It is a conversation where we learned so much about Umama Unomantu and the work that goes into health. Because health, it's not... Most of the things are not the popular things. They're not the headline-grabbing things, unless they are negative. So I'm really happy that you came to our podcast. You really spoke very passionately about what you are doing in the department, what the government of the ANC in Gauteng is doing in terms of servicing the people. And as our podcast is about tackling local issues, it's about how are we impacting people on the ground. So enkosi kakhulu Umama for coming, and there's more that I can see you want to talk about.
I didn't talk to you about the Serve with a Smile campaign that I've introduced.
Which then
my Ziveze campaign.
Yes.
Quite a number of things.
which we as Galondlela, you are inviting yourself to a part 2 of this conversation, and that's what we want. ANC, and it's refreshing to see this, that there are ANC leaders who are really passionate about the work they are doing. There are ANC leaders who I can see that your work is who you are, and that is what we want to showcase to our people and to this country. That ANC leaders are not these people they read about on these propaganda news media. ANC leaders are part and parcel of our communities. So thank you very much, Umama. And to our viewers at home, thank you very much for joining us on ANC Connect today with MEC of Health, Umama Nomantu Nkomo-Ralehoko. Thank you very much, and see you on our next episode.